Now we will perform a uncinectomy. To review the anatomy, we can see that we have the uncinate process free edge here. We have the upper edge, which will become the agonasi. We have the bulla ethmoidalis. We have the basal lamella of the middle turbinate. And we have the semilunar hiatus, which will be where the natural os is. The procedure begins by palpating the free edge of the uncinate process to its superior limit. At this stage, a sickle knife will be used just below the free edge of the upper limit, and a sawtooth motion will be used to resect forward right up to bone. This is a safe cut anterior to the orbit. Now we use a pediatric backbiter. It is navigated into the inferior aspect of the vertical portion, and 2.5 cuts are used to resect the vertical portion up to the lacrimal bone. It is important to angle the last cut at 45 degrees to ensure that we do not injure the nasolacrimal duct, which sits anteriorly. At this stage, a ball probe is used to in-fracture or out-fracture the uncinate process and allow a clean cut with a 45 through cutting Blakesley to remove the uncinate in one piece. Here we can see that we have now removed the vertical portion of the uncinate process. We have retained the superior aspect of the vertical portion in order to use it for our frontal dissection. At this stage, we shift to a 30-degree scope, which is angled down at around the 5 o'clock mark to view the natural os. Here we can see the natural os anteriorly, and it is very important not to instrument this part of the sinus, as this can cause scarring and can affect the outflow. Once the natural os has been identified, we can then enlarge the os posteriorly using a straight through-cutting Blakesley. This is much better than fracturing inferiorly with a suction or another instrument, as it preserves the mucosa along the roof of the uncinate process, and in doing so prevents post-operative edema and swelling. Once the ostium has been enlarged posteriorly to the maxillary sinus wall, we can then dissect out the uncinate bone of the horizontal portion, or simply use a debrider to shave this free edge of the uncinate bone. Here we can see that the arrows of the microdebrider indicate where the blades are, and by visualizing this, we can avoid causing anterior trauma, which can then lead to adhesion formation post-operatively. Here we can see that the os has been enlarged.